Thank you, Madam Speaker. House Bill 2023 was brought to me by a constituent of mine, Keny-Guyer, who lost his only child to suicide shortly before I first took office in 2011, and we have been discussing this concept ever since. Jerry testified along with Julie Majors, who works for NAMI in Multnomah County, who testified alongside her daughter, who also tried to commit suicide twice at the age of 16. This is a really, really critical issue, sadly a very major issue in our state. For years, Oregon ranked between 7th and 9th in the country for suicides, but this has been increasing since 2000 at a much faster rate than the national average. According to the most recent data from the U.S. Centers of Disease Control and Prevention, CDC, Oregon has the second highest suicide rate in the country, and it is the leading cause of death among Oregonians aged 10 to 24. In 2011, 685 Oregonians killed themselves, twice the number who died in vehicle crashes and 6 times the homicide rate. The number went up in 2012 and up again after that. The financial cost is high. In 2010, self-inflicted injury hospitalization costs exceeded $41 million. There are many challenges in terms of filling the gaps in our mental health system, but one that we certainly need to do a better job of is making sure that we don't have a revolving door in the emergency departments when people experience a mental health crisis. This is particularly true for young adults and adolescents. OCAP, the Oregon Council for Child and Adolescent Psychiatry, states that communication between family members and adolescents and young adults seeking treatment for mental illness and primary care providers and mental health practitioners improves the quality of care, reduces the risk of suicide and self-harm behaviors, and encourages the use of community resources to improve overall outcomes. As kids get older, it's important that if they don't choose family members, that they have the opportunity to choose their own support system, lay caregivers. Hospital 2023 directs hospitals to adopt and enforce discharge policies for individuals that have been treated for a behavioral health crisis. The bill states that the policies must be publicly available and include, at a minimum, encouraging the patient to sign an authorization for disclosure of information that is necessary for the lay caregiver to participate in the patient's discharge planning and to provide appropriate support for the patient following discharge. This must include discussing the patient's prescribed medications and the circumstances under which the patient or lay caregiver should seek immediate medical attention. In the physical world, we think of this as, you know, if you get released and discharged after ankle surgery, what happens if it swells too much? Additionally, the discharge policy must include a process to ensure coordination of the patient's care and a seamless transition from an acute care setting to outpatient treatment that may include community-based providers, peer support, the lay caregiver, and others who can execute the patient's care plan following discharge. This was passed unanimously out of our committee after hearing a lot of very passionate testimony. The bill had a lot of input from consumers, providers, insurers, hospitals, and the Oregon Association of Hospitals and Health Systems, who have been working on a similar bill that is called the CARE Act, that targets mostly seniors and making sure that there are, again, lay caregivers that are helping seniors when they get discharged from the hospital. This is a great bill, and I encourage your support.